Hello, everyone. My name is Aaron Hunt, and today I want to talk about the Joint Commission, what they do, and the importance of their mission. The Joint Commission states in their mission statement that they want to continuously improve healthcare for the public in collaboration with other stakeholders by evaluating healthcare organizations and inspiring them to excel in providing safe and effective care of the highest quality and value. The Joint Commission is an organization that offers an unbiased assessment of the organization's quality achievement in patient care and safety. They are an independent, non-for-profit organization that accredits over 22,000 healthcare organizations in the United States. They claim that their goal is to ensure quality healthcare for patients, prevent harm, and improve patient safety. They are the nation's oldest and largest standard-setting and accrediting body in healthcare. They are a very important organization that pushes healthcare professionals to provide above and beyond care. So, for a brief history of the Joint Commission, the first hospital inspections were performed by the American College of Surgeons, the ACS, in 1918, based on the ACS minimum standard for hospitals. In 1951, the ACS joined with the American College of Physicians, the American Hospital Association, the American Medical Association, and the Canadian Medical Association to form the Joint Commission on Accreditation of Hospitals, which is the JCAH. Their primary purpose was to provide voluntary accreditation. In 1952, the JCAH took over the hospital standardization program from the ACS, and in 1953, it published the JCAH standards for hospital accreditation. When the Medicare Act came in 1965, the role of the JCAH shifted, becoming more closely tied with the government. The law provided that hospitals accredited by JCAH were deemed in compliance with most of the Medicare conditions of participation for hospitals and were deemed eligible to participate in the Medicare program. In 1975, the JCAH broadened its reach by accrediting ambulatory healthcare facilities through the Accreditation Council for Ambulatory Healthcare. 4 years later, in 1979, the JCAH established Professional and Technical Advisory Committees, PTAC, for each accreditation program. It is through this latter advisory structure that AORN has interacted most consistently with the JCAH. Then in 1987, the JCAH changed its name to what we know as now the Joint Commission on Accreditation of Healthcare Organizations to reflect its expanded scope of activities. So why is the Joint Commission important? They are for so many reasons because their standards are the basis for helping a healthcare organization measure, assess, and improve performance. Their standards focus on important patient, individual, or resident care and organization functions that are essential to providing safe, high-quality care. They want to continuously improve healthcare for the public and inspire healthcare organizations to provide safe, effective, high-quality care. So if you have their gold seal of approval, that means your healthcare organization excels in providing quality healthcare to your patients. Their standards are often updated to keep up with the changes and advances in healthcare and medicine. There are more than 250 accreditation standards, and they touch on everything from patient rights and education, infection control, medication management, and preventing medical errors, to how hospitals verify that its doctors, nurses, and other staff are qualified and competent, how it prepares for emergencies, and how it collects data on its performance and uses that data to improve itself. The Joint Commission is governed by a 21-member board of commissioners that includes physicians, administrators, nurses, employers, quality experts, a consumer advocate, and educators. The Joint Commission employs approximately 1,000 people in its surveyor force at its central office in Oak Brook Terrace, Illinois, and at its office in Washington, D.C. So, to be accredited by the Joint Commission, an organization must complete a successful on-site survey. A specially trained Joint Commission surveyor or team of surveyors conduct an on-site survey and assess the organization's compliance to their standards. During the survey, surveyors select patients randomly and use their medical records as a roadmap to evaluate standards and compliances. As surveyors trace a patient's experience in a healthcare organization, they talk to doctors, nurses, and other staff who have interacted with the patient. Surveyors also observe doctors and nurses providing care and often speak to the patient themselves. All regular Joint Commission accreditation surveys are unannounced. Most organizations receive a 3-year award, but with laboratory accreditation, they usually only do a 2-year award. Some of the services they accredit include hospital, which can be general, children's, psychiatric, rehabilitation, and critical access hospitals. They do home care, which include medical equipment, home health, pharmacy, and hospice services. They do nursing care centers, which include nursing homes and rehabilitation centers. They do behavioral health care and addiction services. They also do ambulatory care, which include group practices and ambulatory surgery centers. And lastly, they do laboratory services, which include independent or freestanding clinical laboratories. The Joint Commission also has some other organizations and services like the Center for Transforming Healthcare, their international organization, and the Joint Commission resources. The Joint Commission Center for Transforming Healthcare uses some of the nation's leading hospitals and healthcare systems to solve problems by using a systematic approach to analyze specific breakdowns in care and find their underlying causes. They share proven successful solutions with their accredited organizations. They've also developed many tools for improving quality in healthcare, like the Solutions tool, which guides a healthcare organization through a step-by-step process to measure their performance. They've also developed the ORO 2.0, which is a high reliability assessment tool and resource library that helps determine an organization's level of maturity and hopes to have zero preventable harm. The Joint Commission International takes their efforts worldwide and assists international health organizations, public health agencies, health ministries, and more to improve their safety and quality of care. The Joint Commission Resources is a knowledge-based organization that gives solutions to help an organization improve their safety and quality of care. It is a global organization and provides knowledge on issues that organizations may face every day. So to conclude, the Joint Commission is an organization that wants to see healthcare going in the right direction. They set the standards and want safety and quality in care to be above everything else, as it should be. With their accreditation methods, they're able to find and fix problems that healthcare organizations may be facing. And to have the gold seal of approval is something that all healthcare organizations should strive for and be proud to have. So now moving on to the multiple choice question. I decided to choose in what year was the Joint Commission founded? A, 1953, B, 1952, C, 1951, or D, 1965. Finally, I want to thank you all for listening today. I really hope you got something from this presentation. If you have any questions, feel free to send me an email, and I'd be happy to answer them.